Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Pessary. Pessary is a space occupying device. The main principle of pessary is it does not allow the uterus to prolapse. The most commonly used pessaries are Gellhorn pessary or donut pessary. Disadvantages of pessary. Pessary is not a permanent cure. Pessary should be changed every month. It helps to manage the uterocervical prolapse and cystocele. Indications of pessary. Here, prolapse in the pregnant part. If there is any prolapse in a pregnant female, we can use pessary. If there is prolapse in the postpartum period, pessary is used. If there is any contraindication to the surgery or if patient refuses surgery, then pessary can be used.
thank you and thank you for watching.